Now, I've been in the field a long time, 36, 7 years or so. And when you're in the field that long, eventually you start having that comment or that thought that's been shared by other thinkers that the more that you learn or the more experience that you have, you find out how much more you don't know. So I think that's an important piece. But, back in the day, we used to, separate substance use from mental health, different funding, different licensure. And a lot of times what we found out was that our treatment was ineffective. Now, according to SAMHSA, um, and these are our goals that we're going to be working at today in these next 40 minutes. But yeah, just gain a better understanding of this relationship that substance use and mental health have with one another, and the impact that the environmental aspects of COVID has had that Dr. Fialk is going to be addressing. So we do know when we look at the research, the Substance Abuse and Mental Health Services Administration, which is that federal, agency that looks at funding for programs throughout the country. They do a lot of research. They have found 83% of all clients who are receiving treatment for substance use disorder also have another co-occurring mental health disorder as well. That's the rule rather than the exception. But for many years we used to treat it very separately. If I have trauma, for example, and I also have substance use, maybe I might go to the substance use, counseling, work on a plan to get, healthy, sobriety, go to meetings, but maybe not much is done about my trauma. Or I go to the mental health center and I see a therapist and I'm placed on medication to help with anxiety or depression, but really not much is done about my substance use. So after about some 30 years of doing it this way, we have found out that it's been ineffective. We really have to treat, and the research supports it, that we have to treat co-occurring disorders at the same time by the same treatment provider within the same treatment setting. Let's look at some other information too. Clients with a mental health disorder, 25 to 50% also currently have a substance use disorder at some point in their life. We also know, according to SAMHSA, about 17.5 million Americans over the age of 18 had some sort of serious mental health disorder in the past year. Out of these 17.5 million, 4 million struggle with co-occurring disorder with a person having a substance use issue. So let's look at this reliance on substance use and what is this relationship? How is mental health and substance use intersecting? So this is what I call CUBIS. It's an acronym just for 5 things that I believe show this relationship. So if we take the C, a chemical imbalance. Now, we know we have lots of different neurochemicals in our brain. These chemicals help us think and feel, and they affect our mood. But sometimes in some people, and it's no fault to anyone, just a part of my DNA perhaps, that certain levels of these neurochemicals are not where they should be. And maybe as a result, I find myself more susceptible to anxiety and depression. Let's take serotonin, for example. Serotonin is a neurochemical. About 90% is in our gut, about 10% is in our central nervous system. And serotonin affects our mood, our appetite, our personality, our impulse control, our sex drive. It has a lot of important pieces to that. But for some people, we believe that level might be low. And because of that level, we think it might affect someone's vulnerability to depression and anxiety. So let's say, for example, I have this low level and I experience anxiety, depression in my life. And I find, gosh, when I smoke that joint, it gives me that balance. It gives me that homeostasis once again. Or if I feel depressed, maybe I use a stimulant, I look at pornography, or I go gambling, and I find that I can regulate that mood by my actions of using a substance and or perhaps a behavior to help find that homeostasis. And then once again, it's no fault to the individual. This is just part of my DNA that we think for some people, it makes them more susceptible to depression, anxiety, mental illness. Some people, some people have unresolved issues in their life. These are things I don't want to think about, things I don't want to feel. And whenever they bubble up, I find whatever I can to help suppress that. Maybe I suppress it consciously, or maybe repress it unconsciously. But these are things I don't want to think about, things I don't want to feel, things that maybe perhaps happened in the past that are unresolved. Things perhaps like trauma, grief, abuse, abandonment, loss. I don't want to think about that stuff. I don't want to feel that stuff. So whenever it surfaces, I find whatever I can, whether it's porn, whether it's alcohol, whether it's weed, whether it's gambling, whether it's gaming, whether it's meth, as a way to try to contain it. But because it's unresolved, it only surfaces again. It bubbles back up to the top. And this is a problem that we see with lots of folks who go into rehab for drug and alcohol. They continue to kind of have that issue that's relapsing. And we know, some research indicates 50%, even up to 90% in some research shows this high correlation between trauma and one's substance use disorder. So these unresolved issues continue to impact the individual. The B is a belief or beliefs that are distorted. Now, all of us here grow up with a belief system, right? It's how we see the world, how I see myself. It's made up of the messages I get from other people, family, neighbors, relatives, teachers, and coaches. But maybe some of the beliefs that I have, especially about who I am, are not true. Maybe at 10 years old, I have a belief that I'm not good enough. I'm not smart enough. And that belief stays with me. It stays with me into my adulthood. And it affects my relationships with people, my ability to connect, my ability to trust. Maybe I have a belief that the only way I can be social is to drink. The only way I can relax is to get high. Well, we know that's not true, right? You can be social, you can relax lots of different ways. Back in the day, I used to be in a band here in Cincinnati, and some of the guys thought they played better, when they were high. Well, they just thought they played better when they were high. But here's a more dramatic example of this distorted belief. I work with lots of different kinds of acting out or addictive behaviors, and people who suffer from issues around sex. I might see something like this. In a healthy relationship, right, it starts with friendship. Then you develop trust. And then over time, commitment. And then intimacy and closeness and that connection. And then sex, right? Now, we know it doesn't always go that way. People still have one-night stands, and we know there's Tinder out there and things like that. But when we think of a healthy relationship, friendship, trust, commitment, intimacy, closeness, and then sex. But for some people, because of their distorted beliefs, the way that I pursue friendship, the way I establish trust, the way I find commitment in my life is by being sexual. Sex provides the way to meet those unmet needs. So those distorted or irrational beliefs that I have perpetuate the addictive cycle. The I is an inability to cope. Think for a moment of someone who's been a best friend to you, someone that you went to school with, a neighbor, best friend. A best friend is there for you 24/7. A best friend is there during good times and in bad, and you can always count on your best friend when you can't count on anyone else, right? Pretty good definition of a best friend. It's that person that you can call on a Saturday morning to help you move. It's that kind of person, best friend. Well, that's the same relationship that the person has with their substance, with their addiction, with their behavior. It's there for me 24/7, especially the internet. It's there during good times and especially bad times. And I can always count on that drug, that alcohol, or that behavior to do what it promises to do every single time, when maybe I can't count on people in my life. And now I have to give up my best friend to get well. Elton John, the singer, has a song, Saturday Night's All Right for Fighting. That Saturday. He's got a line in the song that says, my best friend floats at the bottom of the glass. It is my best friend. And now here's the kicker. The area of the brain where drugs and alcohol impact the brain, the prefrontal cortex, is the same area of the brain where we develop meaningful, connected relationships. So it's not a big leap that my drug or my alcohol becomes on par with my spouse, with my partner, with my kids, with my parents, and sometimes, unfortunately, it becomes number one. And now I have to give up my best friend to get well. I always find it interesting when I talk about alcohol and best friends, how we give names to alcohol, Jack, Bud, oh, granddad, Samuel, why names? Why names of people, For some, this is their family. And when I've had trauma, anxiety, depression, they've been there for me, unfortunately. And we know how problematic that can become. And then finally, the S is a stimulus response relationship. And this has to do with what we know about the addictive brain. So let's take a quick look at that. So here's the brain. Up in the left corner there, we have the prefrontal cortex, or the executive functioning part of the brain. This is our rational, logical, moral, ethical part of our brain. In the back part, we have the midbrain, which is made up of the nucleus accumbens and the ventral tegmental area. And one thing that the midbrain does that's very important is that it reinforces behaviors that are necessary for our survival. It reinforces behaviors necessary for our survival. And it does that with a very special neurochemical, dopamine. Dopamine gives us pleasure. So if food wasn't pleasurable, we would have died out thousands of years ago. If sex wasn't pleasurable as a species, we would not be here. So the dopamine reinforces behaviors by pairing it with pleasure. Well, guess what? Alcohol, drugs, and other behavioral addictions, they also do that too. So what does that mean? This reward system of the midbrain now gets hijacked. It no longer functions correctly. And when that dopamine is released from the midbrain and floods the brain and hits that rational, logical, moral, ethical part of our brain, it shuts down. It's actually called hypofrontality, a shutting down of the rational, logical part. When this happens, another neurochemical, glutamate, is released back to the midbrain from the prefrontal cortex. Glutamate is the most abundant neurochemical in our brain, and glutamate has a lot to do with memory and learning. The glutamate memory chemical says two things about drugs and alcohol. Number one, don't forget this, and number two, go out and get it, just like food. Now, the brain doesn't really care what it is. It doesn't care if I put it in my vein, down my throat, in my nose, see it with my eyes. Many of the same neurochemical processing is happening within the brain. So it's giving alcohol and drugs and behavior addictions much more importance than it really deserves. So because of this relationship that we see with drugs and alcohol impacting the dopamine reward chemical, shutting down the logical, rational part of the brain, releasing the memory chemical glutamate that says, don't forget this and go out and get it. The brain now believes, in our case, substance use equals, just like food, survival. Now, we all know I don't need alcohol to survive. I don't need gambling to survive. That's true. But the brain thinks we do. And therefore, it drives the cravings. It drives the urges for the behavior. So, but unfortunately, in the past, we have treated addiction like it was all in the prefrontal cortex, an issue of character, a lack of morality, a lack of willpower. Someone had an addictive personality. They were weak. And now we know none of that is true. None of that is true. So when we look at this CUBIS treatment of identifying this co-occurring, this intersect between mental health and substance use, we can also have a template for treatment, chemical imbalance, medication management. Not for everyone, but for a good number of people, they experience depression, anxiety, and that can be helped with medication, even medication-assisted treatment for people with addiction. Unresolved issues, talk therapy, resolving some of those past issues. One of the things that I'm also certified in is the use of EMDR to do trauma work. So many people with substance use disorders also have a high percentage of trauma histories. Beliefs that are distorted, cognitive behavioral therapy to look at rational thoughts, choosing healthy actions, healthy thoughts, looking at inability to cope, new skills, whether it's dialectical behavior therapy, DBT, meditation, exercise, yoga, prayer, whatever that is, it helps a person maintain health and wellness. And then finally, with the stimulus response, education about what's happening in the brain, that it's not about badness. Yeah, addicts will lie, cheat, and steal. But if all of us go 3 days without water, 3 weeks without food, guess what? We would all start to lie, cheat, and steal too, to survive. That's the same thing that's happening here. So we want to look at, well, what is this combination for any given client? And these percentages I just made up, but in a given case, you may have a person who has, certainly unresolved issues, a trauma history. Maybe there's not that much of a family history there. And they have distorted beliefs, but they really, are lacking in skills. So it gives us a template of how to address that individual client by addressing this intersection between mental health and substance use. Now, I want to talk about real quickly here the pathway that's in our brain going a little bit deeper. We have these triggers that take us down this highway 0 to 60 in 3 seconds. And these triggers can be behaviors, grief, loss, abuse, trauma, situations in my life, marital discord, family issues, unemployment, medical illnesses, or just feelings of anxiety, depression, stress. And that takes me down this road very quickly to try to find some type of relief or reward through alcohol, drugs, gambling, or any other behavioral addictions. So the first step is, how do I identify my triggers? And then how do I build this new neural pathway? A pathway towards health and wellness, peace, meaning, and I think connection is so important. But it takes time to build a new road, right? Just like with any road, right? You bring the surveyor in, they do that tripod thing, and gravel and tar and blacktop and oil. It's a road I haven't traveled on before. I don't know what's around that bend. I might have to take things slowly here. So what becomes the gravel, the tar, the blacktop for this? Well, many things. Therapy and medication, yeah, but that's not everything, right? Diet, exercise, the role of the mind, body, spirit, learning new skills, being around healthy people, healthy friends, community support groups, how all these things tend to help support, to build this new neural pathway. Unfortunately, for a lot of people who have substance use issues, I feel a vast majority are using substances as a way to try to cope with their mental illness. That the substance use for many people is just a symptom of the trauma, the depression, the anxiety. Now, some people will ask, does the old road ever go away? Well, if you ever come to the Lindner Center, that's our building way in the back, and there's the main road on the right. And the old road that you see right here, this is the old farm road. And over time, this road starts to be overgrown, and the road starts to fade. But if I go out there today and I drive my car up and down the old road just a couple times, my tires will fall back into the grooves of the old road. My tires will kick up the grass trying to take root, and right away, unfortunately, I think the old road comes right back. So I don't think it ever totally goes away. As one client told me, it's like when you learn how to ride a bike, how can you unlearn riding a bike? The actor Philip Seymour Hoffman, he had 23 years of sobriety, went down that old road a couple times, overdose. People who are recovering from opiate addiction, heroin addiction, 1 out of 4 who had 15 years of sobriety, 1 out of 4 have relapsed after 15 years. So it's a very powerful road that unfortunately is still there for many people. So going forward here, I go forward in my slides. Okay. We also want to look at the environment here, and just want to touch on this real briefly too, about the role of the environment and how important that is. And we've seen this, and Dr. Fialk will talk more about this with the impact of the COVID this past year. But a lot of our research came out of rat studies when it comes to addiction in the early in the early 20th century. A lot of what we knew about addiction came from rat studies, where they would put a rat in a cage and then gave it a choice of water, plain water or water laced with cocaine or heroin. Some of you might be aware of this research. And as a result of that study, they found that the majority of the rats preferred the drug-laced water over the pure water. Many of the rats overdosed, and many of those died in the study. And that was our model for addiction a long time. But later, this research was replicated by Bruce Alexander from the University of Vancouver. He created what he called a rat park, a place where rats could be with other rats, tunnels, levels, a different environment, right? And he gave all these rats, once again, the same choice of water, plain water or water laced with cocaine or heroin. Well, guess what? The majority of the rats preferred the pure water over the drug-laced water. So maybe it's about the cage. Maybe it's about the environment too, right? Now, this next slide is not a research study, but this was based on similar results. In 1975, at the end of the Vietnam War, 1 out of 5 soldiers were addicted to heroin. So at the end of the war in 75, we thought there was going to be about 100,000 soldiers coming back to the United States who were addicted to heroin. They came back to their families, came back to their communities, some back to their regular jobs. And guess what? 95% of the veterans who were once addicted to heroin stopped almost immediately using the drug once they came home. The environment too. Yeah, we know a lot about the brain and about the neurology of addiction, but the environment also plays a significant role. So maybe the opposite of addiction is not only sobriety, but maybe it's also about connection and how important that is. And, Dr. Fialk is going to be talking about that, because think about the lack of connection we've had in this past year, right? So one area that may cause the other, but there's always a relationship. Wellness rates are higher when mental illness and substance use are treated at the same time by the same provider and in the same treatment setting. Relapse, according to NIDA, relapse does not signal failure. There was a time when we used to think that, right? You got to start all over. You're not working hard enough. A lot of blaming and shaming. But it indicates that treatment should be reinstated or adjusted to help the individual fully recover. What do I learn from that makes me stronger? And then finally is my analogy of the moth. If you're walking through the woods and you come upon this moth struggling to get out of this little cocoon, right? It's moving its little moth legs and moth wings, and you decide, I'm going to help that moth. I'm going to tear away at the cocoon, take the moth out and put it on another leaf and go on my way. Well, if I do that, right, the moth dies. The moth needs that struggle to become what it needs to be. And I'm sure, many of us, right, in our own lives have had our own struggles, and hopefully what we've learned from it, what about our struggle that has made us stronger because of it. And that's the same thing that goes with our clients. It is that process of how do I become stronger because of the struggles that maybe I have in my life, but at the end result, how I could be a healthier person because of it. All right, that's all I have. I'm going to turn it over here. Go back to stop sharing. And here we go.
Thanks, Dr. Tuell.
Yeah, you're welcome.
It's interesting because when I, every state is different. There's no sort of federal guideline when it comes to mental health and or addiction treatment. But one of the most frustrating things in New York State is that there's 2 separate governing bodies. There's OMH and then there's OASIS, and OMH oversees mental health treatment and OASIS oversees substance use treatment. And as treatment providers, you generally have to be lumped in one or the other, which we know is just not effective when it comes to providing treatment, because like you're talking about, the overlap and the comorbidity between substance use and mental health. And if you're not treating them both at the same time in an integrated and holistic manner, the success rates don't tend to be great for either of the diagnoses. So I know that's one thing that a lot of people are lobbying to change in the various states that sort of clump them into these arbitrary separate categories. So something to think about. But just to talk a little bit about COVID and how COVID has really changed the landscape in terms of what we're seeing with not only substance use, but also with mental health, and then the challenges that we're facing in terms of providing treatment and holistic and integrated treatment for these conditions. statistically speaking, when we're looking at substance use, we know that 13% of Americans reported either starting or increasing their substance use as a way of coping with stress or with emotions related to COVID-19. I know that in many states where, while many places were forced to, shut down, liquor stores were allowed to stay open, and liquor sales increased, and families and the children who were now living at home with their parents were witnessing, increased substance use as a way of coping with this pandemic. We're also seeing an increase in both symptoms of anxiety and depression. From August of 2020 to February of 2021, the percentage of adults with recent symptoms of anxiety or depression increased from 36% to about almost 42%. And the percentage of those reporting an unmet mental health care need increased from 9.2% to 11%. So more people are feeling like they're experiencing symptoms of mental health while at the same time not being able to get their mental health needs met, largely because the mental health industry was completely overwhelmed during this pandemic. A lot of places were going virtual, and wait lists. I mean, people were just not able to access even virtual treatment, let alone in-person treatment during this pandemic. So they're left in isolation and without the treatment that they need for the symptoms that they're experiencing. Eating disorders is another big one, and we've certainly anecdotally seen this. A survey in the International Journal of Eating Disorders in July found that 62% of people in the US with anorexia experienced a worsening of symptoms as the pandemic hit. And hotline calls to NEDA were up 70 to 80%. I think, for a client that struggles with their relationship with food, this pandemic was a perfect storm. You're being told at the beginning of the pandemic to, load up on food, to buy 2-3 weeks worth of groceries at the same time, and which is very difficult, especially for somebody who might struggle with a binge eating disorder. Also an overwhelming thing to do with somebody who struggles with restriction and just the anxiety and how frenetic grocery stores were during that time. Even stepping into a grocery store without an eating disorder produced anxiety. Imagine stepping in with an eating disorder. In addition to that, the amount, I think we've all probably seen this on this call, the amount of the memes that we were seeing online on social media about COVID-19, packing on 19 pounds and, doing at-home workouts, and the excess amount of time that we were spending on social media and in front of screens was very anxiety provoking for eating disorder clients that were just constantly scrolling and ruminating about, how their body, their physical appearance was going to be impacted by this pandemic and getting all these external messages. So it was certainly a perfect storm. The nature versus nurture and what was going on in the environment around us certainly created a perfect storm between the isolation that people were experiencing, the lack of structure, the lack of having a clear schedule on a day-to-day basis, the increased amount of time people were spending on social media, the lack of access to and availability of face-to-face mental health treatment, and sometimes even the lack of access to virtual treatment, being stuck at home and sheltering in place, maybe with family who were not validating or affirming. There was no way for a mental health crisis not to erupt during this pandemic. I think also what complicated things too is, when we look at at trauma, trauma impacts us in different ways, and there's different types of trauma. But this particular pandemic, what was very difficult about it was that there was no real end in sight. We're still in the middle of it. We still don't know when we're going to be able to walk around in a world without masks, get on an airplane without being worried, be able to hug our friends that we see. We don't know. There's so much uncertainty, and it's been going on for such a long period of time that the trauma is cumulative, and we don't have our normal ways of being able to cope with trauma. Usually, if you look at something like Katrina or the World Trade Center, that were distinct events. They happened, they were devastating, they were horrible, they were traumatic, and then the event was over, and we were able to process it in ways that we naturally sort of process grief and trauma, getting together with friends, hugging, holding hands, having that type of connection. We can't do that. And that complicates the grieving experience. And the grief is happening in multiple different ways. We're grieving the loss of people who we've lost to this illness. We're grieving the loss of our own identities. We're grieving maybe financial security. A lot of people have lost jobs. We're not able to experience important milestones and hobbies. So the grief is also profound and complex. So, as treatment professionals, and we can go on to the next slide, Meredith, I think that it's been exhausting. It's been challenging. Dr. Tuell, at the beginning of your presentation, you talked about how the more you're in this field, the less the less we really actually know, and the more that we're learning. And I think that this pandemic has been a very humbling experience for many mental health professionals, because the old ways of doing things aren't possible and haven't been possible. And we really had to get creative and rethink how to provide treatment for individuals who are experiencing heightened stress, distress, mental health symptoms, which in turn have made turning to substances a very viable and very easy coping skill during this time. How to provide services that are effective during this time. And I think that, what a lot of us in the field have come to the conclusion is that because I agree, the opposite of, when we look at the opposite of addiction, the opposite of mental health symptomatology is really connection. How do we create connection during these times? How can we create hybrid care? How can we create virtual opportunities to or outdoor activities to really connect, not only with treatment providers, but with peers who are struggling with similar symptoms? How do we get the families more involved in and the non-identified patients more involved in the process? Because you have people living together in situations that they wouldn't normally be living together, but the pandemic has brought households together, and they're not only together, they're together 24/7. So how do we really involve the whole system in the process in a way that feels validating and affirming? And then, last, I think, is really how do we help people to, even when they're feeling their most vulnerable and feeling heightened degrees of stress and trauma and grief, how do we help them to step outside of themselves and find a purpose and a silver lining during this time? Are there ways to help people to engage in advocacy or volunteer work or service to give them a sense of purpose during an uncertain time? And I think these are the things, doing these things have been the challenge, but being able to put these different types of interventions into place has made all the difference for individuals who are struggling with co-occurring disorders throughout this pandemic. So with that, what I'd love to do is kind of get into more of a discussion mode where we talk about some of these issues. We have a lot of people on this call who are geographically in very different locations, yet I'm sure we're all seeing sort of similar similar things in terms of presentation and diagnoses and symptomatology. But how have different providers gotten creative during this time to meet some pretty intense needs of clients, and how have you been humbled? What's worked? What hasn't worked? I know we've all made mistakes and learned from the mistakes during these times. I think it's important to honestly talk about the mistakes that we've made and the things that we've learned. So I want to sort of open it up. And Dr. Tuell, of course, if you have any thoughts on any of those issues, I'd love to hear those as well.
Hi, everybody. I have a mental health law practice. I know some of you guys, but I work a lot with families. Hi, John. Hey, Tom. And families come and they kind of present it as, is it the chicken or the egg? Is it somebody with a substance use disorder who is exhibiting psychiatric symptoms and maybe it's a drug issue, or is it a serious mental health issue and they're self-medicating with substances? And the question is, does it matter? Is it really a good way to look at it, or a way that could lead us down one path or the other? And I agree with you, it shouldn't be one or the, it shouldn't be OMH versus, the substance abuse world. But at the same time, in terms of where the family members would go for treatment, the plan we come up with for them to lead them to a solution, is it important to kind of either differentiate or lump them together? I know it's kind of a long-winded question, but it's kind of the chicken or the egg question, really.
No, I mean, well, yeah, Amanda, I can maybe address this. This is an age-old question, but of course, looking at what is that level maybe of, we want someone to be stabilized so we can be able to assess properly in regards to what their mental health issues are. And we know that, several different substances can also, mask as mental health issues, whether it's depression, anxiety, paranoia, or, having, auditory and, visual hallucinations. So it becomes important to have the mindset that both of these areas are very important to address together if we can. I think initially we want to someone that's coming in with a pretty extensive drug history. We want to stabilize that, detox, stabilize that. So now we have a clearer picture, and also, with the assessment process to really determine, is what we're seeing something that's substance induced, or is it something more of a symptom of their mental health, as a way, as I've talked about, coping and just dealing with the issue, so I don't think about it or don't feel it. It becomes my major coping. So, but yeah, I would say, you do want to enter into that view, because it's easy to kind of sidestep the other one, because of what maybe they're initially presenting, but really looking at too, what is that piece that's driving it, and to just make sure that we rule out whether it's substance induced and their use of substances, what substance they're using also plays a very important role too in our understanding of what's going on.
Great, thank you.
Can that too.
Can I jump in here quickly? I'm with National Alliance on Mental Illness, a program director there, but perhaps more importantly, I'm a mother of a 28-year-old who is addicted to heroin. And I have found being in the mental health business, I guess, has helped me understand better that we first found out about her addiction before we got her diagnoses of anxiety and depression and ADD. But looking back in the rearview mirror, I think I can see that she was probably self-medicating with sugar, believe it or not, when she was probably 3 or 4 years old. She was definitely seemed to be looking to other substances to somehow make her feel better. So I think that it's a valid question that does it really matter? I don't think it does. And we had to kind of stabilize her with her addiction first before we could kind of move on with treating her for her other diagnoses. But they seem to go hand in hand. And it's almost like a constant balance of making sure that things in her life don't trigger her anxiety, dealing with her ADD, which causes her anxiety, which causes depression, which makes her relapse. It's so intertwined. It's hard to kind of separate it all.
Yeah. Yeah, I think, you know, just to piggyback on all the comments that have been made so far, you know, Karen, I would agree with that statement that in some sense, does it really matter? I think that what is important is that we can't assess properly what is going on when somebody is still using substances, because their brain is being altered. We don't know, you know, what they are experiencing and how they are presenting at baseline. If they're drinking, if they're smoking pot, if they're using heroin or cocaine, it's altering their brain. So first and foremost, you know, we need to remove that from the equation. And then we can really get a better understanding of what is going on, what the full picture is. And it's usually a nice, intricate mix of a couple of different things going on. I also have found that for whatever reason, and maybe it has to do with what's going on, you know, personally, with family members, being the family member of somebody who struggles with addiction and or mental illness is excruciatingly painful. Your most loved people in your life are in pain, and you want to make them feel better, and you can't. Just like they're powerless over their addiction, you are too. And a lot of times I've found, at least just anecdotally, and I don't know if anybody else on this call has, is that a lot of times a parent might be very invested in having it be only about one or the other. And a lot of this, I'll give it like a case example. If somebody comes in, and Karen, obviously you're in a very different place. If a client comes in and they have they admit that they have been using cocaine or heroin, and that they've also been struggling with mania, and it's obvious that there is some type of mood disorder going on, the parent might say to me, my child's not an addict. They are not addicted. They are not an addict. They just need to get stable from their bipolar disorder, and then they can smoke pot and drink and be a normal kid. Probably not, right? Because even if they're not an addict, however you want to label it, I don't know that utilizing substances while you're, you know, struggling with a mood disorder and on medication for that is going to be congruent with mental health and wellness when it comes to the mood disorder. But or they might say the opposite. You know, this is addiction. My child is not manic. They're just acting manic because they've been using substances. And again, that might be the case, but it might not. So it's really about, you know, helping family members to understand that this is complex, and it might not be about one thing or the other. It might be about both things at the same time.
Yes, and I think too, yeah, just to piggyback on that, how the role of stigma about mental health and the stigma of substance use also impacts that as well. A lot of times when we think of people with a substance problem, we think of them as criminals, right? A lot of times when we think with people with a mental illness, that they're dangerous. And, you know, unfortunately in our culture, that, you know, that prevails with a lot of people, and it really interferes, you know, with the care that a person can get because of, you know, those various stigmas, even coming from a family member.
Right. We see that all the time at NAMI, all the time. The stigma of once they come through our door, now it's through Zoom, the family member has kind of gone past certain barrier in terms of the stigma, and that's a huge leap for them.
Yeah.
But sometimes they refuse to believe that there isn't a miracle that is going to help their family member. They think that they don't understand that this is a chronic disease, whether it's mental illness or addiction, and that means it'll relapse and then there'll be recovery. So it's a long road for the family member as well, for their own recovery. We really, and I learned that professionally and personally, that as family members, you have to accept taking care of yourself in order to help your sick family member.
But one of the biggest challenges we face is managing expectations. Families come and here you are, fix it.
Yep.
We need you to fix it. And, believing it's fixable, and sometimes it is, and sometimes it isn't. But the expectation of what's the reality, either on the substance use side or the mental illness side or the both sides, it's managing the expectations. And, in my world too, the law is not exactly all that helpful. The system is not all that helpful to families. So it's those challenges also. It's not just the clinical side. It's, legally, what can families do to help their loved ones? And, it's a very big challenge for families to navigate through that.
And don't you think, I'm Tom with Lindner as well. On my screen, I'm sitting right next to Dr. Tuell, but it doesn't work out that way. I realize on screens. I have been really vulnerable this last year. I mean, I as we're talking here, I'm just thinking, gosh, what a tough year this has been for everybody. And I feel more vulnerable. I feel like I'm more aware of my anxiety. I'm more aware of my, kind of depressed side. I feel like we're all in this together. This has been a tough year. And it seems like we have slowed the train. COVID has slowed the train down for everybody. And now we're all having to face our own mental health challenges. As you were talking, Karen, I was just thinking, gosh, we're all in this together, whether it's our family member or it's us. This has been a really hard time. And I think when people want answers for their family member, they want answers for their life too now. Like, I want this thing to be over. I want to get started again. I think we're in this together. That's why I'm really grateful for this roundtable. This, for many reasons, I was just aware a year into this, and I'm part of this.
Yeah.
And so I wanted to add that. Thanks.
It's interesting too, because I think right now, especially when we think about family members, and especially working more primarily with the young adult population, this is a population that, if not for COVID, would be in their dorm rooms and living on college campuses and not living at home with families. But because they are now living at home with the families, the symptoms are much more present in their parents' faces, which creates a heightened sense of urgency from the family members. Because when you have that geographic separation from it, it's easier to stay in a little bit of denial, I think. But when it's in your face and you're witnessing it every morning, every afternoon, every evening, it's terrifying for families, which I don't know if that's a bad thing. It's creating a different sense of urgency when it comes to the parent work and when it comes to the family work.
I think it's a good thing because we're seeing a massive increase in demand for our classes. The problem is I don't think the system can withstand everyone suddenly needing mental health services. It wasn't able to support it before COVID, and now that people are so aware, finally, the word is out. You need to take care of your mental health. They can't find services. You can't get a therapist to call you back. Forget about a psychiatrist, and then there's payment. Nobody takes insurance. So it's all bubbling up to the surface how obvious our system is not living up to any kind of real expectation of being helpful.
Yeah. Harriet, did you have your hand up or?
Unmute there. Yeah, my question is, I think John may remember, a grandson who's now 28, who admits to his mental illness, admits to his dependence. You cannot convince him under any circumstances, and his life is being destroyed by it. He really believes that weed helps his anxiety. And he's had several psychotic breaks, and nothing can convince him. You know, I see the total picture, and he's been in numerous programs and none of it has worked. And so I have let go personally because what I've done hasn't really helped. And I don't know that he'll make it. I think if he could give up on the addiction, he stands a chance because he's got a lot of positive qualities. He's very bright. There's a lot of things that he's capable of doing, but it's really destroying him.
Dr. Tuell, do you want to speak about the marijuana issue?
Yeah. You know,
You're not
it's
the only one.
yeah, you know, marijuana, like alcohol, you know, is very subtle, right? It's very subtle about how it works its way into a person's life. I mean, you know, most of us can drink responsibly, be social, drink at parties, holidays, celebrations, right? It doesn't become problematic or out of control. But for some people over time, you know, misuse, abuse, dependency, addiction, how it becomes my go-to. And we know just with the dependency of a drug that, you know, increased tolerance occurs, where I have to use more of that substance to get that same desirable effect. Maybe just to even feel normal again, I have to use that substance. And then it becomes my go-to. And for many people, unfortunately, it's their only go-to. And then eventually the brain takes over and the addicted element of the drug starts to really putting its claws into the drug, where now my brain thinks that this is necessary for me to do. So yeah, it's a slippery slope that starts out, you know, in a very subtle way. It takes the edge off things. It helps me relax. But then as we move down, we know it creates paranoia. We know people with mood disorders, it disrupts their thought process, and it just becomes more and more problematic. So, you know, part of the goal, right, is to how do I develop skills to do all those things that the drug used to do, but to do it in a healthy way. And that takes some time, and that takes, you know, a lot of different strategies to do that. You know, CBT, DBT, you know, what do I need to do each day to feed my wellness, to feed my recovery from my reliance on the substance? And it takes time because those old neural pathways are so strongly reinforced. And it can be very frustrating for a family member and a loved one.
There's an age issue here.
What complicates it even more now, especially with young people, is we all know that marijuana was recently legalized in many states, New York, the most recent. And, you know, for somebody who struggles with an addiction, denial, rationalization, it's legal, Amanda. It's legal. Well, just because something is legal doesn't
Yeah.
mean that it's healthy for you, but it does complicate the picture in terms of how we as treatment providers, the pushback that we're seeing when it comes to looking at marijuana as potentially dangerous for some people, right? Because the number one comeback now is it's legal. That doesn't mean that we don't have interventions and we can't address it, but it certainly does make treatment a little bit more tricky. But marijuana, gosh, especially when it's mixed with mood disorders, psychotic disorders, it's dangerous. It's potent.
Yeah.
I am mindful of time, John. I'm going to turn things back over to you.
Yeah, no, I appreciate that, Chris and Amanda. Thank you both so much for this important conversation today. And I want to piggyback on a theme that I've heard come up and with a couple of different folks, and that's self-care. What are we doing to take care of ourselves? I think what's been unique about this pandemic is that It doesn't matter what country you live in, what state you live in, what time zone you're calling in from on Zoom, what your profession is, what your socioeconomic status is, what the color of your skin is. We are all experiencing this as a world. I can't think of another time when we've all been through this together, in addition to our clients, in addition to their family members, in addition to their siblings. And what are we doing to take care of ourselves? What are we doing to regain perspective ourselves so we can be the best versions of ourselves for our clients, for their families, for our own families, and of course for ourselves. So thank you all for joining us today on this. We're doing this every other week. So we're coming back, let's see, May 6th. We're going to be with Montanito, talking about care on college campuses, in particular around eating disorder support for college students, with, of course, the expectations of students returning on campus here in the fall, what schools are beginning to do, thinking about treatment strategies to really embrace the mental health need that we all know is going to exist as students come back onto college campuses. So please join us for that, and enjoy your 4 o'clock. Thanks, everybody.
Thank you.
Thank you.